Just come on in here and have a seat. So I'm a gum specialist, and I do prevention, and the doctor will come in and she will look at your teeth, and if you need anything done, she does the restorative part. Okay? Okay, great. When bacteria is soft, we call it bacterium. When it's hard, we call it calculus. And I noticed that there's some calculus under your gum line, so I thought I'd bring you over to the computer and just show you. Okay, so if you follow me. Like I said, when bacteria is soft, it's called bacteria, and when it's hard, it's calculus. And this is under the gum line. And so if you can see right here, there's some calculus, and right here there's some calculus. Okay? Calculus has to be 30% hard to show up. And if it's less than 30% hard, it's still there. It's just not going to show up on our x-rays. And so what we're looking for is the whiter the bone is, the healthier it is. And when it starts getting faded like this, in this color it's getting darker, that means that the bone is being destroyed by the calculus. See how it's getting faded? That calculus right there is destroying the bone. So at this time, by just looking at this, it looks like you qualify for a generalized deep cleaning. Okay, so there are different types of cleaning. There are 4 types. We have the healthy ones with no bleeding, no bone loss, no swollen gums. That's just called prophylaxis. That's for healthy patients. We come in, we polish, floss, and fluoride, okay? That means you're doing most all the work at home, okay? So then we have gingivitis, which is bleeding, swollen gums. It means that you don't have bone loss, but you do have an infection. You have a bacterial infection, okay? And after you have this type of cleaning, which is called a full mouth debridement and FMD, we just refer to it as a medium cleaning. After you have this type of cleaning, you'll go back to a healthy cleaning if you maintain your home care. If you're taking care of your gums at home by flossing every night before you brush, and preferably using an electric toothbrush. The next one is periodontitis. There's localized and generalized, okay? So when I'm doing your probing depths and I was calling out the numbers, if you heard, I was calling out some 4s, 5s, and just a couple 6s. So a 4 would be a medium cleaning typically, okay, just swollen gums. But 5 to 11 represents a deep cleaning, which is it's periodontitis. You have some bone loss, and so you had some 5s and 6s, which is mild. Okay, mild periodontitis. And then moderate is 7 and 8, and 9, 10, 11 is severe. Okay, you would know because your teeth would be mobile. And you would probably tell me this tooth is moving. So what we're looking at in this category is typically calculus, which is calcified bacteria, and bone loss, and bleeding and swollen gums. Okay, sometimes you'll have pus, and of course you could end up having recession too. It depends on how much calculus you have.